time for On Point, where we speak to experts to delve deeper into some of the key issues in the spotlight right now. South Korea has been seeing an uptick in COVID-19 cases recently, with the number hovering above 70,000 per day. The Central Disaster Countermeasures headquarters say that at this wave's peak, that the number will be 300,000 daily.
And with infections doubling week to week, health officials have implemented some additional virus prevention measures. But where does the country need to go now in terms of taming the spread of the virus? For more, we have Professor Moon-Kyu of Yonsei University with us today. Good morning.
Good morning. How are you?
Good, good. First, the government decided to bring back some COVID-19 prevention measures for people at vulnerable facilities on Wednesday. Was this enough, or does more need to be done?
Well, currently the Omicron infection is spreading right now, and I think BA.5 is the major subvariant in Korea right now. And in my experience, BA.5 is picking up persons who are not infected before. And well, Korea has a high rate of vaccination, and this vaccination actually cannot prevent infection, but it has an advantage to prevent severe infections. So my point of view is we have to be more focused on severe cases. I mean, if there's a person who have underlying conditions, if his age is more than 65, that means this person might get severely infected and might have to admit to intensive care unit. So I think even though the government has some policies, everybody has to be vigilant and do their job and take care of people who have underlying conditions and elderly.
And Professor, well, on Wednesday, the country reported the highest number of imported infections to date at 429. And, well, previously there were some measures in place like a quarantine period or limited entry, which of course drew a lot of complaints. Do you think these kind of measures are going to be introduced again?
Well, I hope not. I do want to emphasize that we cannot rely on rapid antigen test kits because it doesn't have any meaning if it have a negative result. We have to keep on testing people if needed by a PCR test. And as we know, there were many variants emerging from some countries such as India or Africa. So if a person is coming from that area, we need a special concern for them. And this will not prevent totally unexported cases, but it will slow down. So slowing down has its own meaning, so we can have time to study about the new variant and be prepared for that kind of outbreak. So I do believe we need to do the job as we did in the airports or seaports.
Now, we want to talk more on the medical infrastructure of the country. Omicron subvariant BA.5 is in the country and spreading fast, and it's also known to be more transmissible. Health authorities say the country's medical infrastructure still has capacity, but when do you think is the point when the country may feel the pressure?
Well, we are not at the point of the situation of March or April now, but as I work in an emergency department, I feel the pressure every time with COVID cases. If I have to admit a patient to an intensive care unit, it is difficult to find a bed for them, and especially when the patient has some comorbidity, I mean some underlying conditions, it becomes more difficult. There are hospitals with enough manpower and facilities, but in general, Korea is still not enough for the needs. And I think Korea needs to upgrade the capacity to take care of severe cases in the whole country.
And really, it's the critically ill cases, the patients that we need to be worried about. And as for the daily tally, we've seen it rise before to the hundreds of thousands, and really, well, this time around, how worried do you think we should be about the soaring level of infections that we're seeing day to day these days?
Well, the numbers sometimes makes us tired. I mean, but at least it keeps us vigilant for these situations and what is happening around us. There are many meanings behind the number. There are hidden meanings, and we cannot have the accurate data if we continue to rely on rapid antigen test kits. I think that if you have a high chance to get infected, I recommend to go for a PCR test. And as I previously mentioned, the total number is not that important right now. I think we have to focus on severe cases. I mean, people with high age or underlying conditions. And those people might have to go through intensive care. So the numbers of the ICU beds are important. And also, I'm very interested that how much people are reinfected by Omicron. So I'm waiting for our health authorities to give out those precise numbers. And also I'm waiting for the antibody positive rates, because a few months ago we have a high rate of antibody positive rate, about 95, but it was only a small scale study. So I do wish to have the new data from larger scale of study.
Right, and hopefully, because so many of us, of South Koreans are vaccinated, not that many are sent to ICUs with COVID-19 infection, like you said. Well, thank you for joining us this morning, and we hope to speak to you again soon.
Thank you for having me.